So today we have two amazing doctors. We have a pediatrician and consultant that works with us, and she's going to introduce herself in a minute. And we also have a young doctor, one of our medical officers who will be here, and they're going to be introducing themselves. So, Dr. Mary, over to you.
Hi, everyone. I'm Dr. Mary Uche-Iwu, consultant pediatrician, and I'm happy to be here on Pediatrics To-Go.
Hi, everyone. I'm Dr. Ugowike David, a medical officer at Pediatric Partners, and I'm happy to be here today.
Hey, welcome, guys. So we're going to be talking about myiasis today. And this is just a wonderful topic because a lot of people have seen it, but they don't know what to call it. And here it is. So Dr. David, please introduce the topic to us and let everybody learn about myiasis.
Okay, myiasis, basically, I'll break it down. Myiasis is a condition which involves infestation of a human tissue, living human tissue, by fly larvae. I'll break it down from the origin of the word. So Mya means fly,
Yes.
and sis means a condition. So it's transliterating it means a condition that is caused by flies. You understand? So basically, it's endemic in our region, common in tropical areas, sub-Saharan Africa mostly. And the fly that is mostly implicated that causes this condition is known as the tumble fly in our environment. So it's usually associated, occurs during the rainy season. So you see those that spread their clothing in damp areas. So this fly, they go there, they lay their eggs. So when
On the clothing.
On the clothing.
That you've washed, you've spent
You've
all your
washed,
energy
yeah.
washing the animal.
Yeah, so they
Right.
lay their eggs on the clothing. When you take the clothing in and you wear the clothing, the larva finds their way into your skin. Usually, those that are more predisposed are those that have sores. So the larva finds its way into those places, and then they start growing there, eating into the human flesh. So it's a very gory infection.
Okay.
So yeah.
So how often have you seen it in your practice?
Usually, when I was in training, in Lutz, most of those children come from all sorts of places, Badagry. They come in with the tumble fly, like we call it, or we can also call it mango fly in some cases. So you see the larvae or the maggot penetrate the skin, especially if the clothes are damp and they are spread outside, especially during the rainy season. And at the point of infestation, there's this redness, erythema, and itching.
Kind of like the body reacting to the
subsequently develop into a swelling or something like a boil. So you can see it on the hands, the legs, the
and
back.
the patient will tell you that it's moving.
So the parent's
Sensation.
mom, the parent's mom can now say, there's a boil of my baby's back moving from here to here. So once you get that history, you know that it's myiasis. And in some cases, you just need to either press on it, apply it, petroleum jelly, press on it, or you do a small incision and bring out the maggots.
Yeah.
Then subsequently place on.
Wait, let's see. We're still going.
Sorry.
Okay. So if a parent notices that there's a bump with a white, kind of like a white hole at the top,
Yes.
What are they supposed to do?
So ideally, it's important to bring the child to the hospital because in the treatment, you need to extract the larva whole.
Yeah.
You don't want to rupture the larva or break it inside the skin because it can trigger a very severe systemic reaction. So when the child presents, like she said, you have itching, you could have pain, you could have a feeling of movement under the skin. So when the child comes in, what the surgical extraction is what's usually done. So you apply a petroleum jelly, like she said, or an ointment, which triggers the larva to want to come out.
Because it can't breathe.
Yeah.
Right.
Yeah.
So that, yeah.
Yeah, exactly.
Okay.
So when that happens, you extract with a forceps whole. Sometimes some school of thought would say we want to identify the type of larva it is because there are different types that cause it.
Yeah.
So you want to extract it whole and then send for histology.
For what do they call it? For the identification of the larvae. Yeah. But it's amazing because this is one of the life cycles this is the life cycle. So basically, once the larva comes out, it becomes a fly. And some people will tell you that, they had maggots in their ears because it can lay eggs in the ears, in the nose, and in any wound. So that's why it's so important when one has a wound to cover it and clean it, keep it clean. And in the past, everybody used to use alcohol wipes, and if it's a dirty wound, for sure. And vaccines also, that takes us back to vaccines because it's important. So basically what you're saying is that once the fly comes out, the child should be okay. Would you put the child on antibiotics?
Yes, to prevent systemic infections. So the child needs to be on antibiotics, also on topical antibiotics.
Because anyway, maggot has come out from, you know, there's bacteria.
You need to cover
doing this
infection.
dancing in that space.
So we need to place them on antibiotics, oral and topical. And in some cases, there's steroid cream as well.
Yes, to decrease inflammation,
oral antihistamines to reduce the itching.
Yes.
So that can be done.
Okay, I know in the past, people would wear nappies and the baby would now have bumps. And everybody's like, why does this baby have bumps? Because the flies have laid eggs on the nappies. This is before diapers, disposable diapers. So what is one way to prevent myiasis, Dr. D?
One very important way is ironing.
Ironing the clothes. So ironing actually kills the larvae?
kills the larva.
The larva,
So once you get clothes in, you, especially in regions like ours where it's common, you want to iron your clothes.
So ironing, good old, hey, when we were growing up, when I was in boarding house, if you don't iron your uniform, you stand aside and kneel down.
I even prefer you emphasize on sun drying. So they bring in the clothes before evening. So they sun dry them, bring it in, then you iron before you keep it in, because you don't want to iron a damp cloth. The larvae will still survive. But once it's dry, then you now hot iron them. You have finally eradicated the larvae.
So ironing is still very important.
Making sure your environmental hygiene is top notch. Because you cannot be chasing larvae and you also have maggots in the cupboard. So the environmental hygiene.
So cleanliness, keeping things clean.
Exactly.
You know, doing whatever. What about, some people ask you, but there's a way that some people might end up swallowing the larvae. What happens when they swallow it? Because that can cause diarrhea. But I guess the stomach has a way of eliminating
I think the stomach acid would
kill it, would neutralize it.
Yes, in some cases stomach acid. In some cases you give them all those anti-helminthics. Like ivermectin has been known to cover a whole range of worms. So that's will work.
Okay, so I think the bottom line here is prevention is always better than cure. Simple ironing will decrease the amount of infections that we see in children, especially babies. And is there anything else that we need to talk about concerning tumbu fly? Why is it called tumbu fly? I'm just curious. Do we know?
Well, the other name I know is mango fly.
Mango fly.
Tumbu. And Myiasis.
In some places also called the butt fly.
Butt fly. Yes. There's all kinds. You know what? There's all kinds of names for these flies. The bottom line is flies is part of their life cycles to have larvae, and those larvae can penetrate the skin. It can go in through the ears, any open space. It has actually caused retinal detachment in some people in the past. It gets into any open orifice. So ears, eyes, nose, mouth, and skin. So basically keeping the environment clean, hygiene, having a shower and bath, ironing your clothes. That's the bottom line. You just need to prevent it so that the children are not uncomfortable with all these myiasis. So thank you so much, Dr. David. Thank you, Dr. Mary.
Thank you.
And we'll see you next time. Thank you for joining us. Have a good day. Bye-bye.